Hello and welcome to our podcast series sponsored by Aster Hospitals. This episode is all about plastic surgery. Whether it's for health or just to look good, we try to cover it all in this podcast. Let me clear this at the beginning that plastic surgery does not involve any plastic. In fact, it comes from a Greek word called plastikos, meaning shape. So in this episode, let's reshape our understanding about plastic surgery as we speak to Dr. Madhusudan G, Lead Senior Consultant Plastic Surgery at Aster Hospitals, Bengaluru. Hello doctor, welcome to this podcast.
Thank you.
Firstly, what exactly is plastic surgery and what happens?
Plastic surgery is a part of surgical field where we do the change in the shape. Basically, plasticos name molding. Plastic is a material which can be molded into any shape. That's the beauty of that material. So that's why the name to that material came because of plasticos. To name to our specialty also comes plastic surgery. So it is a shaping, means you alter the shape, form and function.
Okay.
This year in plastic surgery, we celebrated Plastic Surgery Day. Yeah. The main theme is that from Shushruta to the 21st century plastic surgery. So everything is evolution of the surgical field. Actually, in India is the first country where we started telling that we should do some plastic surgery day. It was not there before.
Okay.
So in last 10 years we've been starting, and the July 15th is the day.
Okay.
And the main aim of this day is to make people aware what plastic surgery do to the community. So because there's a lot of myths involved. So to clear all the myths about plastic surgery, all over India, all over the world, we celebrate and we start declaring, go to the public and tell what's about it. So that people know about it.
Okay. I'm sure there are a lot of categories in plastic surgery. Surgical, non-surgical. What are the differences between all these?
See, surgical and office plastic surgery is a place where we do non-surgical work. This
like
is
Botox fillers.
Yeah, this has been a grey area where dermatologists do, plastic surgeons do, and lasers. Okay. So facial plastics using Botox fillers. But some are done as a daycare patient comes to OPD, you do procedure and let them go. Some surgeons we have to do under anesthesia in the OT, local or general. So it is an overlapping field. It involves both surgical as well as non-surgical field. It is how you develop your practice as a plastic surgeon. In our training or mentoring, we have been trained both surgical and non-surgical plastic surgical methods. How we take our profession. So we do that. Basically, if you say plastic surgeons are more of a surgical field, and we do know about all non-surgical practices
as well. Okay.
Yes. So it's how we take our profession in, and sometimes we work in close collaboration with dermatologists, and most of the couple are dermatologists, plastic surgeons. They do very well because they have a lot of cross reference between them, and a very good place is where we don't quarrel with each other, because so many gray areas where we also do, they also do. So in my opinion, plastic surgeons, we do know about all non-surgical methods, and we also practice them to great extent.
Now there's something called as cosmetic, aesthetic, reconstructive surgery. What are all these, doctor?
Like a car. If the engine is breakdown, you go and get it repaired. But if car gets injured, body part, you go to the same place and body part repair is done. So it's similar to that. Like there is reconstructive surgery where you reconstruct. There's some cancer reconstruction, post-trauma reconstructions, like congenital the anomalies of the face, and cleft lip and palate reconstruction. Just like, and also functional reconstruction of hand, where it comes where you do importance in the form and the function and form. Cosmetic surgery is a part of it, so you're making it more beautiful. Your plastic surgery, you're taking the skills to improve the aesthetics of a particular part, like rhinoplasty. So we do rhinoplasty for a very deviated nose, a blocked nose, or a loss of nose, as Shushruta has done in that era itself, reconstructing nose with the cheek and forehead skin. But at the same time, cosmetic plastic surgery is making a nose more beautiful. So technique are the same, but the intention what we're doing is for cosmetic purpose. So that becomes a cosmetic surgery.
These days, plastic surgeries are becoming very, very common. Is it because it's becoming more affordable or how?
Awareness, basically. People used to know that this is available.
Okay.
Availability, accessibility, then comes affordability.
True.
Because affordability depends on which place you go and get it out. You can go to a medical college, you'll get operated in. You'll go to government medical colleges, your cosmetic surgeries are done free of cost. You can go to the biggest and very richest cosmetic center, you get pay high and then get the same class cosmetics. So it is affordability depends on where you want to go, your comfort levels, like hotels you choose and where you eat, like similar to that. But it is the accessibility to the public and also awareness which has increased now, and people are coming forward because now present generation wants the need is looks, because the opportunities depends on how they say. So there is more need for being look better, and they're more aware about themselves.
That adds to another question of mine. Sometimes plastic surgeries can be life-saving, right? On the contrary, social media and the generation that we're talking, or the mindset of people, which is gradually changing. In fact, a study says 60% of people actually want to look like their selfie. It's called as Snapchat dysmorphia.
Okay.
Right? So with filters on and everything, so they want to look like this, and they come to doctors asking, make me like this, right? What is your take on this, doctor? Personally, I feel it is against nature. Is that okay?
No. Usually those coming to the plastic surgery with a cosmetic intention, like the clientele who comes for, we cannot tell them as patients, they are clients who coming, they're healthy person who coming with a cosmetic sense, cosmetic betterment. We usually do a very good outpatient conversation with them, knowing what they want and why they want.
Okay.
Because end point, there is, see, in any surgery there's a complication, there's some failure.
True.
In cosmetic surgery, failure is an unhappy patient is a failure.
Okay.
You do a lot of work on the person and do a very good quality cosmetic surgery on a person, and suddenly person is not unhappy, he's unhappy with the entire result, then it becomes a failure. So unless until we know what is the patient psyche, what is his intentions, so that where comes your question. If someone says that I want to look like Shah Rukh Khan, we cannot just make like that. So what is the realistic expectation of the person? We have to discuss pre-surgery to them very well, and to know them, where they stand. If they're really unrealistic, they usually go off. They'll keep searching, they do shopping. Okay. And those are realistic, we tell them what you want, what we can do more than what you're asking, or what we cannot do what you're asking.
Okay.
We'll make them understand what is, because they will have come with some knowledge, without knowledge or over knowledge, which is not there, and they listen to some people who are not undergone plastic surgery, just give some reasons. Okay, so we give them awareness what it is. Some demonstrative pictures, some old patient you operated, only to them to show that what is it, what is that, what happens, and all. We discuss with them. Sometimes some situations we have to send them to psychiatrists also.
Okay.
If some people have the body dysmorphic syndromes, very difficult to operate. If you operate on them, then finally they end up in thinking that what we did surgeries make them more wrong. So there's a lot of things in that. So preoperative evaluation of the person, their problems, whether the end result is mattering to them, how much they're serious about it. And there are something which results depends on their post-operative, their homework. Like any scar revision we do, we tell them to take around 6 months of scar treatment. That treatment is a very purposeful thing the person has to do. If they don't do, any best work will give an ordinary result. An ordinary work will give best result if they do very well. So everything we tell them beforehand, and we take selected patients and operate. When we take a selected patient, then the results are very good.
What surgical procedures do often celebrities get it done, doctor? Hair transplant?
See, no.
Okay.
Celebrities want quick fix. Okay, hair transplant takes 1 year to come, so it doesn't come that way. They're off with wigs and hair ads and all. That's okay. It's the rhinoplasty, to make the nose beautiful. They do facelifts, then Botox fillers for the aging face, and people do liposuction, tummy tuck, breast implants. So all type of procedures.
Okay. Doctor, I'll quickly move into some questions which are commonly searched on Google or on search engine.
It is rapid fire.
Kind of.
Okay.
Why is cosmetic surgery or plastic surgery more affordable in Korea? South Korea, preferably. Why is it so common that people add it in their resume?
Because the more and more cosmetic surgeries were happening there initially. It is like early birds.
Okay.
The people know more about that. See, there is some other reasons about it. Because in Korea, most of the female wants to get their noses reshaped. Because most of Korean noses, Chinese noses, are very, very flat. So it is the most common, rhinoplasty is also most common surgery being done. So the need is there.
Okay.
The people awareness is very good. So the number of procedures also done are very high. That's one of the reasons I am telling this.
Okay. Is plastic surgery reversible?
Sometimes yes, sometimes no. So that's why we have to counsel them when we are doing irreversible surgeries.
Okay. Can plastic surgeries fail?
As I said, failure is unhappy patient.
Unhappy patients.
Yes, do some other complex surgeries. We do what we call microvascular surgeries, like a tissue transplant. We transplant like cancer reconstructions and all. It's a very complicated surgery where the success depends on a connection of blood circulation, and it has inherent failure rate of about 5%.
Okay.
And we tell them before we do that.
What happens years after plastic surgery?
See, rhinoplasty, for example, the results will become better after 1 year. Okay. And sometimes I said, if you do liposuction for a lady and they look very nice and they once again start eating, the results will go back. So there is individually different surgeries have its own downtime.
Best age for plastic surgery?
95 years.
Oh God. Who should not get this done? Who is at risk?
Nothing like that.
Okay.
You are telling about cosmetic surgery?
Anything, plastic surgery,
No.
cosmetic surgery.
Nothing like that. See, elderly patient on a bedridden patient have a bed sore. Plastic surgeon does the bed sore surgery. And we have to do surgery for that. Otherwise, it is life-threatening.
Right.
So that is nothing that age limitation.
Okay.
And one thing is that if someone wants a very like a cosmetic surgery, which they have a very very serious heart diseases, highly uncontrolled diabetes, hypertension, very high risk anesthesia for a long period of surgery. If sometimes our surgeries go for 8 to 10 hours, if the person is not fit to go for that long anesthesia, life risk involved, then only we say we don't.
Okay. Nose job, lip fillers, Botox, facelift. What's trending? I mean, I am only naming 4. I'm sure there are many other, but what's trending?
Nothing is trending. Everything is there, but the fillers are nowadays being used. Botox has been there since long years. And nose job is every plastic surgeon does nose job regularly. More and more nose jobs also coming. Facial plastic surgery for is becoming more and more common.
Once you get fillers or Botox, it is said that one person needs to get it done again and again. Is it true?
Yes.
Once upon a time, or at least few years ago, it was women were associated with beauty and things like that, and women wanted certain things. They wanted it this way. But I'm sure the trend is changing. Men also get a lot of cosmetic procedures. Am I right? And if so, what are they?
Yes, most of the men cosmetic surgery is male breast reduction nowadays.
Okay.
One of the most common male cosmetic surgery is male breast reduction, which is very very deserving, and it gives a lot of change in their appearance, and which are really disturbing them, and they are very happy with this kind of thing. And another thing is rhinoplasty. People do come for rhinoplasty. Most of the male plastic surgery we do about scars because they get injuries. Accidents are more common in male. They get injuries, facial injuries, deformities. They do come for plastic surgery procedures. So as far as the cosmetic surgery, less come for liposuction, but they do come for liposuction. But most commonly it is the male breast reduction. It happens at the age of adolescence, when the male child is becoming male adult. There will be little hormonal surge which will happen. Even males will have a female hormone as initial.
Correct.
In the pathway. Female hormones make male hormones. That enzyme before that making a female hormone becoming male hormone, like estrogen becoming testosterone, that enzyme, if produces little late, and there is a surge of estrogen in the blood before it gets converted to testosterone,
that's when this problem.
then the breast gets stimulated and the breasts are produced, and that will not go back.
Okay.
Even the non-binary people also.
Right. Absolutely.
Because that's very important nowadays, because it's not just male and female, it is the transgenders.
True.
And their aesthetics is also very big, because I work on with them. I do respect them and their aesthetic requirements.
I have covered almost all that I have made note of, doctor. Is there anything else that you would like to add?
See, plastic surgery is a huge field. We operate from head to toe, from hair transplant to a ingrown toenail, which most of them suffer from. So many times we operate on ingrown toenails and we do hair transplantation. It's all over place, and we do a lot of serious plastic surgery than cosmetic surgery.
Okay.
And cosmetic surgery becomes a part of it. And what I say is that people should not hesitate to meet a plastic surgeon. They should meet, tell them what they are going through, and we are there to fix to the best of our ability and to match their expectations.
Now that's a lot of information Dr. Madhusudan has shared with us. Thank you so much for coming over and sharing a lot of information about plastic surgery. I'm sure it's a very vast subject. We could cover tidbits of it. Thank you so much.
Thank you so much for the time you've given to us.